Well, my friends, this is a case of aneurysm of posterior auricular artery. Posterior auricular artery. This gentle lady is about 39 years, is suffering from aneurysm of the posterior auricular artery. See, there is a big aneurysm, a big amount of swelling. It is due to aneurysm of posterior auricular artery. Auricle means ear. This is anterior side, samne. This is posterior side. So posterior auricular artery, facial এখানে carotid artery এসেছিল, তার ব্রাঞ্চ চারিদিকে গেছে, facial artery, posterior auricular artery, posterior মানে ব্যাক সাইড অফ দ্য অরিকেল। এই আর্টারিতে রক্ত এখানে অ্যানিউরিজম হয়ে গেছে, ফুলে গেছে। So posterior auricular artery, aneurysm of the posterior. Now what is aneurysm? I have repeatedly told in my many videos, the aneurysms are the sac. Aneurysm at the sac. When the artery becomes dilated, when the artery while running, suddenly it becomes dilated. And again it comes into its normal shape. This dilated portion is known as aneurysm. ঠিক নদীর মতন, নদী যেমন চলতে চলতে কোনো এক জায়গায় পাড় ভেঙে বেশি অনেকটা ধান জমি গ্রাস করে নিয়ে চওড়া হয়ে যায়। কালি ঠিক আছে, ঠিকই আছে। So this is called aneurysm. So what is aneurysm? I have told you the aneurysm means a ballooning, a weakened area of an artery. Aneurysm often occurs in the aorta, in the bigger vessels, and also in some other arteries. Arteries supplying to the brain, যেখানে ব্রেনের দিকে রক্ত যায় সেই সব আর্টারিতে অনেক সময় বেশি হয় due to rush of blood. Back of the knee joint, it may occur in the intestine or in the splenic artery too. A ruptured aneurysm can result in internal bleeding and stroke if it ruptures within the brain. It can sometimes, at that time, fatal. So aneurysms often have no symptoms until they rupture. Clinically, aneurysm have no symptoms until it ruptures. The only danger is when it ruptures, the blood comes out, which may be a condition of fatal. So what is aneurysm? Aneurysm is the ballooning or swelling, abnormal swelling of an artery, any part of the artery due to pressure of blood. So there is no treatment in allopathy. In modern medical science, that is only wait and wash, and if ruptures, emergency surgery is to be done. So this is called aneurysm. Now why the aneurysm forms? Keno hoy? The aneurysm forms only, the main cause is rising of blood pressure. Hypertension is the main cause. Over many years, when a subject becomes hypertensive, the aneurysm may start slowly and gradually, and resulting in damage and weakening of the blood vessels. The fatty plaques, অত্যন্ত বেশি বাঙালিদের মধ্যে যারা ফ্যাট খাবার খাওয়া হয়, fatty plaques known as atherosclerosis, resulting in a weakness of the blood vessel wall. So this is called aneurysm. So how to control the aneurysm? By controlling the blood pressure, eating a healthy diet, avoid of salt, avoid of smoking in case of males and other who are habitually smoker, So this is the anatomy of aneurysm. Now this gentle lady developed the aneurysm of the posterior auricular artery. What is posterior auricular artery? We know from the arch of aorta begins the brachiocephalic trunk in right side and left side direct common carotid artery and subclavian artery. The common carotid artery goes upwards and very soon it divides into two branches. One goes into the brain known as internal carotid artery, another is known as external carotid artery. External, বাইরের দিকে. And the external carotid artery, the branches of the external carotid artery are 8 in number. Superior thyroid artery, ascending pharyngeal artery, জিভে সাপ্লাই দিচ্ছে জিভকে lingual artery, supply to the all facial muscles, facial artery, backside of the head, occipital artery, কানের পিছনে posterior auricular artery, superficial temporal artery, maxillary artery. So there are 8 branches of the external carotid artery. So the common carotid artery, it divides into 2 branches, external carotid artery and internal carotid artery. The internal carotid artery goes to the brain and supplies to the brain, but the external carotid artery gives numerous branches. One is, our subject is posterior auricular artery. কানের পিছনে যেটা চলে গেছে. This is the posterior auricular artery. See the branch from the external carotid artery. This is the posterior auricular artery is going to the back side of the ear. See the name posterior auricular artery. Posterior মানে পিছন দিকে, back, auricular মানে কান, posterior auricular artery. এই posterior auricular artery যেখানে কানের পিছনে ঢুকে গেছে সেইখানটায় ওনার অ্যানিউরিজমটা ডেভেলপ করেছে. দিস ইজ দি পোস্টেরিয়র অরিকুলার আর্টারি. এই যে মাসেল কাটা হয়েছে, মাসেলের ভিতর দিয়ে চলে গেছে, এইখানে অ্যানিউরিজমটা হয়েছে. নাও হোয়াট এভার দি অ্যানিউরিজম অর এনি আদার ডিজিজ ম্যাটার লিটল টু হোমিওপ্যাথস, টু মি, দোজ হু আর উই আর treating the patient as a whole and not the disease. Aneurysm is not a factor to us. Our factor is the patient himself or herself and his or her totality. This patient, my patient representing the symptomatology, these are for sweets, these are for warm food, মিষ্টি খাবার খেতে মোটামুটি ভালোবাসে, খাবার দাবার একটু গরম খেতে ভালোবাসে, and this is of course a right-sided complaint, and you know lycopodium is a great and right-sided remedy. So right-sided aneurysm, these are for sweets, these are for warm foods, and weeping disposition, etc. Fearfulness of the mind indicates the medicine is lycopodium. So I do like to prescribe lycopodium in 50 millimolar scale of potencies, and let's see the result. Let's see the fate of this aneurysm. We shall look after the case, and you should also. Please remember this video number, my friends. So this is a case of aneurysm of the right posterior auricular artery, and my selection is lycopodium on the basis of symptom totality of the patient, considering the symptoms, these are for sweets, these are for warm food, right-sided complaints, weeping disposition, etc. So let's see the result. I shall share you, my friends.